This video provides general information about endocrine conditions to schools, licensed childcare facilities, and agencies providing respite. It is based on the standard material produced by the Unified Referral and Intake System. The pituitary gland is located at the base of the brain and is often referred to as the master gland. It controls several other hormone glands, including the thyroid and adrenal glands. It also produces hormones that are important for normal growth and puberty. The adrenal glands produce cortisol and other hormones that are essential for bodily functions. Cortisol assists the body in coping with physical stress, such as illness and injury. A deficiency of cortisol can be life-threatening if it is not managed properly. Adrenal insufficiency occurs when the adrenal glands do not produce the right amount of hormones to meet the body's needs. The treatment for adrenal insufficiency is oral cortisol, which is taken 2 to 3 times daily, usually at home. A stress dose of cortisol is required when a child is experiencing significant physical stress, such as illness or injury. Primary adrenal insufficiency results from a loss of cortisol due to the total dysfunction of the adrenal glands. The most common cause of primary adrenal insufficiency is Addison's disease. Congenital adrenal hyperplasia is a form of primary adrenal insufficiency where the adrenal glands do not work properly. With secondary adrenal insufficiency, the pituitary gland does not send the hormone that stimulates the adrenal glands to produce cortisol. Signs of physical stress include nausea, vomiting, fever, cold, clammy skin, pale face, dark circles under the eyes, unexplained dizziness, weakness, and confusion. If the child experiences signs of physical stress, administer the stress dose of cortisol. Call the child's parent. If the parent cannot be reached and the child's physical signs persist for 30 minutes, call 911. The priority is for the parent to be notified and take their child home. A child that is experiencing physical stress should not remain at the community program, even if the stress dose of cortisol has been administered. Do not send the child home on their own. Symptoms of acute adrenal insufficiency include severe vomiting, seizures, and loss of consciousness. If the child experiences any of these signs, call 911. Administer the stress dose of cortisol if the child is conscious. Notify the parent. The treatment for acute adrenal insufficiency is the administration of cortisol by injection, which cannot be done by community program staff. Arrangements may be made for the injectable medication to be stored at the community program and administered by the parent. Storing injectable cortisol at the community program is recommended if the response time of medical personnel is prolonged. Some children with adrenal insufficiency may experience hypoglycemia. The child may bring a blood glucose meter to the community program to check their blood glucose level when experiencing signs of hypoglycemia. However, they do not require routine blood glucose monitoring. Signs of hypoglycemia include cold, clammy, or sweaty skin, tired, shakiness or lack of coordination, irritable or moody, difficulty concentrating, staggering gait, The child may complain of nervousness, excessive hunger, headache, blurred vision, dizziness, and stomach pain or nausea. If the child is showing signs of hypoglycemia, check their blood glucose, if their meter is available and time permits. If their blood glucose is less than 4 millimoles per liter, or they are showing signs of hypoglycemia, have the child eat a fast-acting sugar. Wait 10 to 15 minutes and check their blood glucose again. If it is less than 4 millimoles per liter, or they are still showing signs of hypoglycemia, have the child eat a second fast-acting sugar. Wait another 10 to 15 minutes and check their blood glucose again. If it is still less than 4 millimoles per liter, or they are still showing signs of hypoglycemia, have the child eat a third fast-acting sugar and call their parent. If you are unable to contact the parent, call 911. With severe hypoglycemia, the child may experience a seizure or loss of consciousness. If this occurs, call 911. Place the child in a side-lying position and notify the parent. Do not give the child food or drink. The nurse will provide additional information, if necessary, on specific needs of children in your care. Instruction on how to respond to the child's endocrine condition is also included in their healthcare plan. If you do not know which children in your care have an endocrine condition or how to access their healthcare plan, talk to your administrator.